Tonight, the state of Iowa has agreed to make major changes to how it provides mental health services to Iowa children on Medicaid. It's part of a settlement agreement in a class action lawsuit. KCCI Chief Political Reporter Amanda Rooker shows us what new policies the state has agreed to in this settlement. Amanda.
Well, Stacey, this brings a major shift to how the state will help kids on Medicaid who are experiencing severe mental health conditions. The goal is to try and keep these kids in their normal setting at school or with family and friends while still getting them the help they need.
The agreement settles a class action lawsuit filed in 2023 by Disability Rights Iowa and other health advocacy groups against the director of Iowa's Health and Human Services Department. It accused the state of a, quote, long-standing failure to provide legally required and medically necessary mental health services. The lawsuit claimed that without intensive home and community-based services, young Iowans were at risk for more problems, including, quote, self-harm, hospitalizations, and repeated institutionalization in restrictive settings, where children are separated from their parents, families, schools, friends, and, quote, decline socially and academically. For more than a year, the plaintiffs and the state negotiated to reach a settlement. A judge gave initial approval last week. The agreement lays out a detailed plan for change and a new strategy for care called Iowa Reach. In a statement, Kelly Garcia, the director of the state's Health and Human Services Department, said the agreement and the strategy, quote, signify a major step in the right direction for Iowa youth and their families. She also said that her department is, quote, fully committed to implementing new strategies and evaluating current outcomes to ensure we're meeting the needs that our children and youth deserve and families expect. The settlement requires the state to develop and roll out key services, including intensive care coordination, intensive in-home services, and mobile crisis intervention. And the state will also set up a quality management and accountability structure to make sure young Iowans are getting the care they need. In a statement, the executive director of Disability Rights Iowa said the group is, quote, pleased to be a part of this monumental change in addressing the pitfalls of the current system and finding solutions to improve the mental and physical well-being and safety of Iowa's youth.
A lot of change to come here. A judge set a final approval hearing on this settlement for early May, and the implementation process is supposed to start this year. The state has to complete it by the end of 2032. Stacey.